Hello YouTube. It is Burbazooka. That's how your grandchildren will be born. 5 most fashionable and desirable ways to give birth. How are you going to give birth? Is the first question that a pregnant woman most often hears. And, by the way, they want to hear from her absolutely special things. In the water, standing, with the douche. Alternative births are becoming more popular lately, and young mothers do not stop looking for the most natural and optimal way of reproducing the offspring, getting rid of the old conservatism classical obstetrics. Childbirth in the water. If the mother-in-law chooses newfangled genera in the water, she receives a number of undeniable advantages. The relaxing and analgesic properties of water help to ease fights, improve blood circulation, relax and take a comfortable position. In addition, water eliminates the occurrence of such unpleasant sensations as dry skin, increased sweating, chills or a sense of heat. In addition, adherents of the newfangled method are convinced that childbirth in the water reduces the level of stress for the baby when it comes to light. Water softens the transition from one environment to another. However, it should be understood that staying in the water during delivery without risk to the health of the mother and baby is possible only under the supervision of qualified medical personnel and with strict adherence to certain rules. Opponents of this method are convinced that water increases the total time of childbirth and is generally dangerous for a newborn. A child can swallow some not quite clean water and even choke. Alternative methods of delivery. Vertical birth. If you think that deliveries in sitting or standing position are some kind of innovation, you are deeply mistaken. Habitual delivery for us in the supine position was introduced into obstetrical practice only in the 18th century and exclusively for the convenience of taking delivery obstetrician men. Alternative management of labor. Until then, our ancestors gave birth in standing position, squatting or hanging on another person, considering this method of delivery more physiological and comfortable for a woman. Today, many maternity hospitals are trying to introduce vertical births in midwifery practice anew, because they have much more advantages than the usual delivery in the supine position. In the sitting position, the woman relaxes, the uterus does not press on the blood vessels, and the probability of hypoxia of the fetus is reduced to a minimum. And, importantly, my mother's attempts are less painful, so there is no need to use painkillers and stimulants. Active childbirth. This method of childbirth has long been a normal practice in modern maternity homes. The woman in need is no longer chained to a hospital bed. She has the right to move around the ward, change postures, use massage to prevent painful sensations and even walk around and round. With this method of delivery, a woman lays down only in case of necessity of carrying out any medical manipulations and directly at the moment of the birth of the child. Active births combine the vertical position of the parturient's body and the constant motor activity. All possible movements in the ward, rocking, pelvic rotation and inclinations improve the blood supply of the uterus and the placenta, thereby guaranteeing a constant supply of oxygen to the fetus during the entire delivery process. Movement, massage and proper breathing help the expectant mother to distract and relax, and also reduce pain during labor. Childbirth with a douche. Our compatriots use our doula services more often. Doula is not a doctor or a midwife. She is an experienced woman and a mother who is well versed in female physiology and provides all the necessary support to the woman in childbirth before, during and after childbirth. Doula, like no other, understands all the needs of women during childbirth. Often, she alone cares about a woman in labor, her comfort and emotional state, which, alas, often does not have enough time for a midwife and an inexperienced husband. Doula supports the woman and her partner, helping to pave the way to parenthood with joy and satisfaction. Lotus birth. If in the process of traditional birth the doctor waits until the umbilical cord stops pulsating and then cuts it, Then during the lotus delivery the doctor expects the birth of the placenta and puts it next to the newborn without affecting the umbilical cord. Proponents of such unusual births are convinced that such a way of birth facilitates the transition from the uterus to the baby, and attachment to the placenta in the next few weeks makes it possible to extract from it all nutrients, including stem cells and cord blood. However, doctors are convinced this kind of birth is deadly for newborns, because the risk of bacterial infections rises at times. Nevertheless, supporters of such transgender have more than enough. Thank you for your time and attention listening to me. Don't forget to hit the like button and subscribe to our channel. You can also click the bell sign to be informed about new videos. Have a great day.